The risk of pregnancies in the United States are higher than you might think, especially if you are a woman of color. Maternal death rates among African American women in the United States are extremely frightening. Black women are 3 to 4 times more likely to die from a pregnancy and childbirth related death than white women. The United States is the only developed country that has the worst rates of maternal deaths. According to the Center for Disease Control and Prevention, half of these deaths are preventable. Racial and economic disparities, as well as healthcare inequities, are some factors that contribute to the high numbers of maternal morbidity in the United States. Childbirth complication deaths are significantly more common among women of color, low-income women, uninsured women, and women living in isolated areas. These women lack access to the best healthcare resources. Giving Birth in America is a documentary series produced by the Every Woman Count program that sheds light to this terrifying social issue through the traumatizing experiences of women who experience any sort of childbirth complication in the United States. Tamara McQueen Saba, an African-American mother of 2, faced a life-threatening complication during labor in her first pregnancy. In 2010, after giving birth vaginally to her oldest daughter, Gigi, one late afternoon in April, Tamara suffered postpartum hemorrhage, which means having an excessive amount of blood loss that nearly killed her. A year later, Tamara Saba suffered from another massive blood loss due to a miscarriage. Her miscarriage was due to improper healing from her near-fatal traumatic experience the year before. A statistic shows that 18% of births involve postpartum hemorrhages. People should be aware about the severity of maternal mortality in the United States. Health complications for women during childbirth are skyrocketing, and half of the time could be prevented. So, what if childbirth death rates were no longer a problem? This would mean that no woman would ever have to face the fear of experiencing a life-threatening complication during what is supposed to be one of their most bittersweet, joyful moments of their life. This would also mean that whole families wouldn't be destroyed by the loss of the mother. And lastly, every child would have the opportunity to grow up next to a mother's love, support, and guidance.